we are working into a very challenging landscape. We are trying to do what we can with what we have to coordinate, to reach out to partner, to support. I should give a story for a child who was having malaria. When they brought him, he was in pretty bad shape, but they stabilized the patient, they give him the medication they need, and in 3 days, that child was sitting, talking, seeing those kind of cases, interacting with mom who say, I didn't know that my child will be alive today, you know. Those kind of stories, those kind of experience, it's very rewarding.
We have many people who have come from Sudan have experienced traumatizing situation moment. We have seen children who are almost dying, but through our services, we have been able to help them and we have seen them improving. And then we follow them up through the community until they recover. People tend to lose hope, but when they see an extra hand supporting them, that hope can be built and think like things can change tomorrow.
We work in areas that were previously occupied by the Russian forces. Air attacks have been constant. We have been bombed and had drones, missiles coming through the skies at us. The statistics on how much time we've spent in bunkers, in some places like more than half the year. When the Russians were forced out, they left so many landmines. One of the things that we needed to do was do sessions that were relevant to children, whereby they would understand the dangers of landmines.
I love the work we do in maternal and child health. We operate a NICU in each settlement, seeing tiny infants, some the size of your hand, that might otherwise have died, be treated and cared for until they are strong enough to be reunited with their family, with our neonatal and maternal mortality rates being up to 6 times better than the national average.
Our staff, the environment under which they operate, it's mostly remote and it's mostly resource limited. I often think of a 5-month-old infant showing severe malnutrition. So medical teams volunteer identified the infant during a routine home-to-home visit and rushed him to one of our nutrition centers. And after 2 weeks of care, had a full recovery.
Across many communities in the U.S., access to healthcare is becoming increasingly difficult. Dental care is frequently one of the first services that people go without, which is why our mobile emergency dental clinics remain such an important part of our work. In 2025, we delivered 579 mobile clinics, serving more than 4,400 patients and providing nearly 19,000 dental procedures.
The people we serve are just like you and me. They have hopes and dreams, but due to the location of their birth, they struggle to find opportunities we take for granted. Our work brings both practical, life-saving and life-improving support, which ultimately inspires hope.
I see the end results, saving life, giving hope. These are the things that are really motivating me and keep me pushing.
One time, one woman say, where are these donors coming from? And I told them, majority of them are from US. And she said, because white, black, all people contributed for us. You cannot contribute for someone who is not your relative. So we have relatives in the US. People really appreciate your support and they feel that you're brothers and sisters because you're coming into their refuge. You're helping their cases.
For our donors, I would say thank you. Not just for the generosity, but also for the compassion. Any support that's provided, it becomes medicines, it becomes food, it becomes trained health professional. And overall, it becomes, hope for families who have lost almost everything.